pinched nerve, slip disc, and arthritis. So now today we are going to speak about how these three are interrelated and to give you a better idea as to what is going on when you get a diagnosis of a pinched nerve or a slip disc or arthritis, in the case where you're having back pain with pain and numbness and tingling traveling down the back of the leg. So first we'll start off with what the normal spine looks like. So this is here's a model of the lower back, the last two vertebrae or backbones. As you can see here, this here is a healthy disc. The disc is made up of two general parts, have the inner jelly-like layer and this tough fibrous ring that keeps the jelly in place. So you can see here, you have disc in between the bones. This here allows for cushioning. It allows for proper movement of the backbones when you're flexing and extending. And down the center here, this space here, that is what is called the spinal canal. And here are some of the nerves of the spinal cord that are traveling down the spinal canal. Here are the exit points of the nerves that supply the lower limbs. In the case of the lower back, if this were the neck, these would be supplying the arms, the hands, the shoulders. Okay. These here are called these are the spinal processes. These are the bones that you feel right here. The hard bones you feel here, that's what these points are. Okay. So now you have an idea as to what the normal, healthy lower back looks. Okay, now in the case of, let's say you have a pinched nerve. In the case of a pinched nerve, what you can have is a herniated disc or a slip disc that is compressing on the nerve. Now, let's look at this slightly damaged disc. You can see here, when you compare it to the original one that is good, you can see all of the jelly is contained well within the fibrous ring. In this one here, a person may have suffered maybe some trauma, maybe just through some degeneration because of age. What is happening here is that there is a slight weakness in this fibrous ring of the disc, and now you have some of the fluid beginning to bulge outward. And what can happen here is that this disc here can become herniated. In other words, the fluid is pushing the disc into the spinal canal. Okay, and in cases where you have a severely herniated disc, you can actually block off part of the spinal canal and begin to compress on the spinal nerves. And this here is a situation that is called spinal stenosis. Now, if you look at this lower part here as well, in this situation, you do have some disc herniation, and you can see if it herniates enough, it is actually going to pinch on the nerve. And in situations such as sciatica, which is really a pinched lower back nerve, you have this situation developing, and where the nerve is pinched here now, this pinching now leads the person to experience pain and tingling and numbness down the leg, and depending on the severity of the herniation, which leads to the pinching, a person can actually also experience one limb weaker than the other. Okay, so there can be loss of strength depending on how severe the herniation is. When the herniation now starts, what happens? The initial symptoms are pain and tingling. As it gets more and more severe, the person reports maybe some numbness down the leg, numbness in the toes. And when it's really severe, along with that, the person is going to report a weakness of the limb. They're not walking properly. They can't climb stairs as easily. And of course, there's the associated lower back pain as well. So this is the case here of a disc herniation. Or let's say we have a more severe situation. There's let's say a ruptured disc. Compared to the one before, you can see in the first one, the one we spoke about before, while there is some breakdown and degeneration of the fibrous ring, the jelly is still well contained within the disc. Now, also I want you to note there is some bony degeneration comparing it to the one before. While there was some rupture of the ring, I want you to compare the bones here. You can still see the disc height is still preserved. In a more severe situation where you have leakage of the fluid, you can expect logically a disc maybe that was this thick, when you have leakage of the fluid, is going to be less thick. That's what you're seeing here, where the disc is less thick because of the loss of the fluid. And also as well, in this situation may arise where a person has some accompanying bony degeneration, as in the case of arthritis. This right here, this little bony growth here, that is what you would call a bone spur. Okay, when you do the CT or the MRI, even on the X-ray, the radiologist would report the presence of bone spurs once they are there. Comparing it to the one before, there's no bone spur per se, but the bones in this case here also show some signs of degeneration. If you want to compare it to the healthy one, see how nice and smooth these edges are. And as a person ages, or let's say the person gets an injury, what you can also get in the course of the injury is some bony degeneration. See how rough those edges are. They don't look as clean and neat as in the normal spine. Here, this is a situation of arthritis, and in this case here, there's some drying up of the jelly. Comparing it to the normal one, you want to compare the disc heights. See the disc height here? Or the height here? Look at that height. And now look at this height. So if you have drying up of that jelly, you're going to lose disc height. And if you lose disc height, then the bones are going to become closer and closer together. That's what you're seeing here compared to the normal one. See the distance? Watch this. Loss of bone height. Again, this is a bone spur as well. Now, if you look on the other side of the model, in the picture of arthritis, a person can also have rupture of that fibrous ring. There's weakening of that disc. There's weakening of the fibrous ring, leading to a leakage of that jelly. And again, it's going to compress on the nerve. So in the case of arthritis, a person can experience sciatica in the case of arthritis. Now let's just, for argument's sake, say there was no leakage of fluid, but if these bones, if you're getting bone spurs, extra bone growth developing, you can also get some bony growths in here as well. By the same principle. When you have a lot of chronic inflammation, you have the body laying down excess additional bones within the soft tissue. That's how you get these spurs. And let's just say in this case, if this person had some bony growth in here, you will actually begin to compress the nerve, not because of a ruptured disc, but rather because of the additional bone growth. So those are two mechanisms by which you can get a pinched nerve in arthritis. Okay, so hope this shed some light on that topic. And if you're having any issues with your lower back, any arthritis, sciatica type pains, if you've had a CT or an MRI that reports these findings, feel free to drop us a message. You can even take photographs of the reports, take photographs of the films, and send it to us on WhatsApp. And we would be happy to take a look at it for you and advise you from there.